Hi, my name is Dr. Robert Kaufmann, and we're about to go beyond the Terminus. Today we're going to do something a little bit different. We're going to discuss the role of the specific exam. What does this mean for the specialist referral? Referral to a specialist imposes certain obligations on the referring clinician and for the specialist. Each of the specialties is a little bit different. For example, if you're going to refer a patient to an orthodontist for an orthodontic consult regarding braces, generally the orthodontist will examine the patient's occlusion, take some study models, take the appropriate radiographs of the entire mouth, and treat the mouth as a whole. That's the nature of orthodontics and treatment of the occlusion, full mouth treatment. Similarly, referring to a prosthodontist, a crown and bridge specialist for placement of a prosthetic in one part of the mouth, usually involves examination of the occlusion in order to produce a prosthetic restoration that is in harmony with the occlusion and the rest of the mouth. Other specialties seem to have different levels of examination. For example, when I send patients to an oral surgeon for extraction of an impacted tooth or surgical biopsy, I never get a report that indicates any other area of the mouth has been examined, charted, or that any other finding, other than perhaps an incidental radiographic finding in the case of a large radiolucent area in a panoramic image, has been discussed with the patient. The examination is pretty much limited to the referred problem. In the case of a periodontist, the gum specialist, a patient can be referred for examination for treatment of a localized area in one part of the mouth that's symptomatic. Acute periodontal disease can be confined to a specific location. Where chronic periodontal disease is present, problems are frequently more generalized, and referral for one specific problem may be a clue as to a more widespread problem in the mouth that needs to be addressed. Does limiting the examination to one area relieve the clinician of the obligation to chart the other areas of the mouth and address those at the same time? If the periodontist did not examine the rest of the mouth, does this absolve them of the responsibility of discussing any of those findings with the patient at the time of examination? For example, if there are open contacts contributing to caries and perio problems, or if prosthetic restoration contours or other factors are contributing to periodontal disease in other areas of the mouth, do we inform the patient, or is sending information onto the referring dentist sufficient? The endodontic referral appears to be quite different. Symptomatic endodontic patients are frequently referred for a specific procedure on a specific symptomatic tooth. As such, it's very easy for the endodontist to limit their scope of examination and focus on one tooth without examining the mouth as a whole. The question remains, how much of an obligation do we have as dental specialists to examine the entire patient's oral condition, even though we're only working in one specific area or one specific tooth? Does the fact that the patient has been referred for one procedure relieve us of the burden of examining the rest of the mouth, noting any deficiencies or pathology, and mentioning them to the patient at the time of examination? Do patients have the right to know what we found when we opened their mouth and examined it? Some general dentists prefer that these notations be made in the chart and that the information is relayed to them either by phone or in letter form, and this not be mentioned to the patient at the time of oral examination. Question remains, is this ethical? Do patients not have the right to hear directly from the examining clinician exactly what they found? What are the medical legal implications of not discussing this with the patient at the time of examination? Well, it's unlikely that a very significant finding would escape notice by most conscientious clinicians. It's not unrealistic to have these significant findings overlooked while one is focusing their attention on a specific tooth or a specific problem. This is the dilemma that faces many specialists. Rather than being part of an entire treatment team, patients are frequently referred for a procedure rather than making the specialist part of a comprehensive treatment plan which is thoroughly discussed, evaluated, and assessed prior to referral. The legal implications of such decisions can be profound. In the United States, there's an entire legal industry based upon finding fault and collecting huge sums for what is called negligent care. They search for what is known as the deepest pocket, the healthcare care provider with the most valuable malpractice insurance, and then frequently make a deal to settle the claim, generating a contingency fee of between 30 to 35% of the entire settlement. Fortunately, I live in Canada, and this system doesn't exist here. The chart system bases any wrongdoing on what is necessary to make the patient whole. This prevents the outrageous settlement numbers that are generated in the US. I recently asked a colleague who I respected what he thought of the question. For me, He said, the question is very simple. In ethical questions like this, what you are really asking is, who are you ultimately responsible to? Some see their responsibility as guarding their own well-being. In those cases, you make a calculation. How will being honest with the patient harm me? Some see their responsibility as doing whatever is necessary to protect the referral relationships that one depends upon. Still others see their responsibility as derived from the Hippocratic oath they took when they graduated. Some actually take that oath seriously and believe its wisdom. When confronted with these conundrums, I tend to answer them with an even more simple question. What would I want and expect as a patient? I believe if we treat patients as we wish to be treated ourselves, the decision is easy. When we do the right thing, we both get better, patients and clinicians. Please remember to subscribe and like. This channel is free. I look forward to our next trip when we go beyond the terminus.